So hello everyone and welcome to my channel. And in my today's video I am sharing an amazing soft tissue mobilization technique for the patients who are having neck pain and shoulder pain due to trapezius muscle stiffness, tightness or hyperactivity. Trapezius muscle is a large and superficial muscle that extends from the occiput to the back area, especially to the thorax area. This muscle tightness can lead to pain, tenderness and tension in the neck as well as in the shoulder. So let's treat this muscle with the soft tissue mobilization exercise, and let us start with a practical demonstration. So to treat the trapezius muscle, the patient is in the supine position and the therapist has to sit at the head end. So trapezius muscle contributes in the shoulder elevation movements and also in the neck movements. So this is your trapezius muscle. This is your trapezius muscle. You can lift your shoulder up. So this is your trapezius muscle. This is the superficial muscle. Now you can palpate and find the tender point on the trapezius muscle. So you have to palpate perpendicularly across the muscle fibers. So let's say this is the tender point, and at this side this is the tender point. So you have to locate your finger pads and thumb pads on the tender point in this manner, anteriorly from the thumb pads and posteriorly and inferiorly from the first and second digit finger pads, and you have to apply a squeezing pressure on the tender points and hold this position for at least 1 to 2 minutes or until the tenderness is released under the finger and thumb pads. You have to press this tender point and lift slightly the trapezius fibers in a cranial direction and hold this position. When the therapist feels the tension under the finger pads is released in a melting manner, then the therapist can release his position and relax. And after one session, the therapist again recheck the tenderness in the tender points and relax. Again, what has to be done? The patient is in the supine position. The therapist has to locate the tender points in the trapezius muscle. Now, from the finger pads and the thumb pads, the therapist has to grab the tender points in a squeezing manner and lift the trapezius fiber slightly in a cranial direction and hold this position and apply a pressure towards the tender point. When the therapist feels the tension under the finger and thumb pads is released, therapist can release this position and relax, and again reassess the tender points. Relax. So try this amazing soft tissue mobilization technique in the patients who are having neck pain and referred shoulder pain due to the trapezius muscle hyperactivity, and let us know your valuable feedback in our comment section. Till then, stay connected and thank you.